Hello and welcome to Legislative Report. I'm State Representative Seth Grove of the 196th District in York County. In my time as a state lawmaker, I have focused on making sure taxpayer dollars are spent wisely. It's important that all our state agencies stay vigilant and eliminate waste, fraud, and abuse wherever it may exist. On this month's program, I want to talk about the Department of Public Welfare and its mission to give the truly needy a hand up instead of a handout. With me today is a very hardworking Secretary, the Secretary of Department of Public Welfare, Gary Alexander. Secretary, thank you so much for joining us today. I appreciate your time.
Thank you for having me. It's a pleasure.
Yeah. Now, you're in charge of one of the biggest operations in state government. Your footprint is all over the state through your local Department of Welfare offices, not to mention you have a plethora of programs designed to help people, obviously move from welfare, assist people in their most needy, onto work or taking care of seniors in nursing homes. So the scope of your job is, I would imagine, massive.
Well, you're absolutely correct. It's a $27 billion plus dollar budget with close to 100 offices around the state for our most neediest citizens. And so we do the best job we can to maintain integrity in our programs and still deliver the needy services to our constituents.
Yeah. Up until 2 years ago, we've really seen huge ballooning in our Department of Public Welfare. 2 years ago, we as a General Assembly, led by the governor, came back and said we need to do a budget reset. We cannot sustain this level of funding moving forward. We did about $1 billion cut overall to state government. I find it ironic, your total budget's $2 billion, which includes federal money, and our entire state budget with state funds is about $27 billion.
Absolutely.
So just a massive amount of money flowing in there. What are those cost drivers that you're seeing within our DPW budget?
The largest cost drivers we have at the Department of Public Welfare come on the long-term care side for our elderly and disabled individuals, simply because they use the most services. And so what we've started to do is put in place pragmatic reforms to be able to sustain those services but drive the cost down. Governor Corbett was clear from the beginning that he wanted to preserve benefits for the most neediest and truly eligible individuals, but yet he's told his cabinet heads and me in particular to live within our budget, and that's what we've had to do. There's enough money in the budget. There's $27+ billion, as we said. We just have to become more efficient, and that's what we've been doing over the past 18 to 20 months. Mm-hmm.
That's terrific, and it's a tough job to do. Obviously, any turn you make, we're impacting some group of individuals, right. But it's a necessity to shrink the size and scope of government.
Yeah, I mean, I think that a lot of times people think of the Department of Public Welfare just being for poor individuals, but the department has grown vastly over the last 15 to 20 years, and as a principal funder for hospitals, nursing homes, residential group homes for the intellectually disabled. So we do a myriad of things there. And when you're that large, sometimes you become inefficient. Yeah. So we've been focused on really making program integrity, fighting fraud, waste, and abuse our top priority.
Yeah, that's terrific. And I know a lot of taxpayers out there in my district love hearing that we have a lot of individuals in York County that, salt of the earth, great individuals. They love working, great work ethic, come from that blue collar families just like my parents did. And while they want to help individuals, they hate to see the abuse in the system. They hate to see people who are able-bodied citizens capable of working but choose not to, instead trying to defraud government and live off the government versus finding their own means. So I think it's terrific. Now, you've done some great stuff as secretary. You found some individuals that are dead and some individuals that don't live in Pennsylvania anymore.
As I said earlier, when your system is so large, $27+ billion, close to 17,000 employees, and you stretch throughout the Commonwealth, you are going to have instances where you see fraudulent behavior. And we've made that a top priority to crack down on it. And one of the areas was looking at recipients who may be receiving benefits in another state, as well as receiving benefits in Pennsylvania, and also looking to see through our caseload whether we have deceased individuals and we're sending checks to families illegally. And we found that we've had close to 1,000 individuals receiving benefits in other states that we've had to terminate on our caseload because, of course, we want people to receive benefits, but we certainly don't want them receiving benefits in 2 states, and of course we certainly don't want to see them receiving benefits in 2 counties in Pennsylvania. And we've seen instances where we have recipients who shop around from one county to the next. So we've really had a razor-sharp focus to crack down on those, ensure that we're only giving out what's necessary to keep people sustained and on the road to independence. But in the end, we can't afford to be inefficient. So it's a massive job, and we're trying our very best. We're not perfect, of course, but in the end, I think we've made great headway over the past year and a half. We've saved the taxpayers close to $1.9 billion through these efforts, and it hasn't been easy. We've had to, go through our caseload, identify individuals that are ineligible, because as I said earlier, when the system grows that large, sometimes we're not being attentive to detail, and by doing that, we've been able to drive the cost down. The department was growing at double digits, over 10% year over year. And as you know, Representative, with revenues growing at 2% in the Commonwealth or around there, it makes it pretty difficult to balance a budget or find funds for other needy programs like education, transportation, and other things. So we've had to really look at only serving those who are truly eligible, and even when we do serve those that are truly eligible, we have to ensure that they are only getting what's necessary to become independent.
Yeah, and I think that's the critical aspect of it. It shouldn't be generation to generation passing it down. It's not a way of life.
Right.
It's temporary assistance to get you back into the job force.
That's right.
Be a productive member of society.
Absolutely.
Totally agree with you. Now, in the 2011-12 budget, we did some reforms within the welfare code. Drug testing for convicted felons, which surprises me. You get those mass emails of Florida and Michigan doing flat-out drug testing, which is being litigated and probably going to be upheld as unconstitutional.
Right.
We in Pennsylvania took a different track that should pass constitutional muster. I'm not even sure it was even attempted to be litigated at all, but random drug testing for those on welfare who have had a prior felony conviction. We've done 19-point check. We did stop shopping county to county to try to get multiple benefits in multiple counties. So we've done a lot of reforms. Can you kind of update us on kind of where they're at in the system?
Well, we have, when it comes to program integrity, there are really 2 main issues. One is our provider community, the other is our recipients, and we have to balance that. But in relation or in regard to the reforms that were put in place in the 2011-2012 budget, one of them was drug testing. And you mentioned that Florida and Michigan have a similar program that's being litigated. The difference between Pennsylvania and those states is that I think we're taking a more compassionate approach, allowing individuals basically a 3-strike and you're out a methodology, so that if we find that they have a drug they're a drug convicted felon, that we give them another chance to redeem themselves before eliminating or cutting them off from the program, whereas in those other states it's a 1-strike and you're out. And we've seen some preliminary data. We implemented this in Schuylkill County, and we've moved to Luzerne and some of those other areas of the state. It's a little bit too early to tell because it's only been about 8 or 9 months since we've implemented this, but early preliminary data is showing that it is working as a deterrent. I don't think we'll see the full effects of that until a few years out.
Yeah.
Some of the other reforms you talked about, shopping across county lines, let's face it, none of us as taxpayers want to see recipients or beneficiaries shopping in one county for benefits and then trying to get something different in another county. We've really, through our increasing our data exchanges and our updating our IT systems and enabling our workers to be more vigilant in where our recipients are moving, have been able to really decrease those activities by about 30% across the state. So it's had a significant impact on saving us millions of dollars. The other aspect to some of those changes were the data exchanges we have. And we have a number of data exchanges, whether it's with the IRS or employment data, national employment data, and we've really started to increase those data exchanges so when an individual comes in, we see the full impact of their financial status so that we can award them the correct amount of benefits. Because if they have assets or they have money in the bank, we need to know about that.
Yeah, that's great, and obviously doing everything we can to shore up taxpayers' money. Let's take a quick break, and when we get back, we'll continue this wonderful discussion with Secretary Alexander. We'll return in one moment.
Did you know that Act 16 of 1999 honors one of the greatest leaders in the Pennsylvania House of Representatives? The Matthew J. Ryan Legislative Office Building, once known as the Capitol Annex, is located next to the main Capitol building and honors the late Speaker of the House, Matthew J. Ryan. Those who visit this building will observe the magnificent architectural designs providing eloquence and grandeur to the building. Known as one of the greatest members in the history of the Pennsylvania State House, Matthew Ryan started his career in the legislature in 1963 and was elected Speaker in 1981. His charisma and knowledge will forever be reflected in the building now named after this great legislative leader. Now you know. Did you know that the chamber of the Pennsylvania House of Representatives contains a painting depicting the 24 hours of the day? Located in the center of the ceiling, the mural, titled The Hours, was created by artist Edwin Austin Abbey. This wonderful masterpiece charts the setting of the sun, moon, and the many stars that grace the heavens. 24 maidens, who each represent an hour of the day, begin each day in light and gladness and ends in solemn drapery carried on still shoulders. Now you know.
Welcome back to the program. I'm State Representative Seth Grove. Joining me now is the Secretary of the Pennsylvania Department of Public Welfare, Gary Alexander. We were just continuing our talk about welfare reform, obviously trying to provide services to the most needy, individuals who are stuck in a tough time, getting them some assistance back into wealth or back to the workforce. Recently, the President signed an executive order waiving allowing states to opt out of the welfare to work requirements. Obviously, we did something different where we strengthened the welfare to work requirements here in this state, so we're taking a completely different track. I have a lot of constituents that if they would go into a convenience store in the morning, they may see somebody with the EBT cards, go to the ATM machine, pull out money and buy cigarettes and buy gambling tickets. Obviously, we stopped that. You can't do it point of sale. Obviously, we can only go so far, and until we hit a brick wall called the federal government.
Absolutely.
We have certain criteria that we need to meet because we do shared. Every state dollar is a matching fund from the federal government. If we don't do X, Y, and Z, we don't get the federal money out of it. What can we do to advocate to Congress, to advocate to the President, to advocate to those individuals at the federal level? What can we do better to help us do a better job here in the States?
Well, sometimes it's very difficult to advocate because I think the federal government has never sat in our shoes. We run the programs, we operate this on a daily basis. These are challenging programs to operate, and more challenging to operate them from Washington, D.C. And that's why you see a disconnect sometimes between the federal government and state governments, simply because we know best how to help these individuals attain independence. Unfortunately, we have to adhere to a myriad of onerous federal rules and regulations on a daily basis that change quite frequently and come down from Washington and make it very confusing, not just for us as a department or a state, but for the recipients. Because we have to remember that these programs should be consumer-based and for the people we serve. They're not for us as administrators or for the government. So in the end, if the federal government would allow us to operate these programs as we see fit, not only could we save money, but we would probably have more individuals independent. And you brought up an interesting point about the work requirements, because as we all know, in 1996, the federal government passed welfare reform, and that was supposed to give more authority to the states to be able to operate their programs. And that program or that initiative worked. We saw hundreds of thousands of individuals nationally coming off of the welfare rolls because states had more flexibility to operate. In the same way, if we don't receive that flexibility from Washington, we won't be able to have our recipients achieve independence. And as the federal government is loosening requirements, here in Pennsylvania, we're tightening our requirements on work to ensure that when someone comes in the door to apply for benefits, that at the same time they're searching for a job. Because if you're an able-bodied recipient, we want the best anti-poverty measure for everybody is a job.
Yep.
And unfortunately, here in Pennsylvania, we weren't doing that. But by the good graces of the legislature, has done a great job enacting laws to help us tighten that, and obviously with the governor's drive and determination to ensure that every Pennsylvanian has a job. We are now able to ensure that when someone comes through that welfare door, that they're not just going to get a check, they're also going to have to search for a job, and if a job is available, they're going to have to take that job rather than a check.
That's terrific. It's I think the goal that Pennsylvanians want to see. I know it's something the legislature is very animate about. Obviously, providing benefits to the most needy.
That's right.
But having those able-bodied individuals who need temporary assistance get temporary assistance and back to the workforce. Now, you've been an advocate for basically block grants from the federal government coming down.
Absolutely.
And not only are you advocating for that, we also implemented a block program for counties in the state. Well, I think we both agree that it should be carte blanche for all 67 counties. Hopefully we'll get there. Maybe this upcoming budget season we'll get all 67 on it. Was very excited to see that. I was 100% behind you. We had, obviously it was scaled down to 20 counties. We had, 34 apply?
Yes.
Can you kind of give us an update on that?
We have 20 counties that have been awarded the block grant. The block grant provides the counties with great flexibility. When I came to Pennsylvania, one of the first things that I heard from our counties was, give us more flexibility to operate. And I think if you go around, not just Pennsylvania, but our nation, people in our localities and local government, whether it's counties or cities and towns, they want more flexibility. We understand that we can't operate everything out of Harrisburg. The counties know better how to serve the recipients, just like we here in Pennsylvania know better than Washington, D.C. And we've awarded 20 counties the block grant. The block grant will give the counties great flexibility to move money around, to be able to serve individuals. So if they have a need in housing, they can fulfill that. If they have a need in mental health, they'll be able to fulfill that. And in the end, we're building a system where we have performance measures, outcomes, and scorecards so that the general public and taxpayer will be able to see where the money is going, how it is being used, and if it's being used effectively. Up until now, we've been giving money to counties, and we have no idea as to the effectiveness of a lot of this money. So we want to ensure that we're giving flexibility to the counties, being consumer focused, but also reporting back to the taxpayers to show them that there is a benefit to this. And for those counties that are performing and doing well, helping individuals attain better health, get to work, safety for children, those counties will be rewarded. with enhanced funding in the future. So that's sort of the future, and hopefully through the good graces of the legislature, we'll be able to expand this to 67 counties, because I believe that all 67 counties want real flexibility.
Yeah, without a doubt. We've been hearing it for years, and it's great to see finally the administration coming through, an administration that was elected to come through and provide the greatest form of flexibility.
And let me just add one more thing, Representative. This particular block grant is the only block grant in the United States that's been given to a locality that blends both health care dollars and social services dollars. So if you look around the country, we've had the TANF block grant from the federal government. That was more social service dollars. Other states give counties flexibility, like New York, built on social service dollars, meaning housing or transportation. But no state has given counties the flexibility that Pennsylvania has by looking at healthcare dollars, state-only healthcare dollars, and social services dollars, and blending them into a flexible block grant so that counties can really drive independence and better health outcomes.
Yeah, it's more comprehensive approach.
It is.
You know, prior for those 47 counties that don't have it, it's siloed.
Very
you
siloed.
have X amount of money, you can only use it for that amount.
Absolutely.
And if you have too much money in that account, you may need it over here in drug and alcohol, and you can't. There's no way to do it, so you're stuck using it for that silo.
Absolutely.
So that's great. Hopefully we can get school districts down that road and a lot more, and hopefully the federal government learns from the success of block grants and provides the flexibility.
Well, that's what we're hoping. We got to get the word out.
Yep. So if there's a congressman watching this show, block grants for Pennsylvania at least. That's
right.
great. What other stuff are we going to be looking at down the road? What's on your agenda? For the next legislative session, what can we look for?
Well,
down the road?
I think we mentioned one of them is expanding the block grant. We want to ensure that it gets to all 67 counties. We want to ensure that we continue this drive on program integrity, fighting fraud, waste, and abuse. We have a number of new initiatives on overpayments and recoveries, looking at high-risk providers, high-risk recipients, reining them in to ensure that we're going to save millions more dollars in the system. And Pennsylvania has taken a unique approach to fighting fraud, waste, and abuse in the welfare system. We're the only state in the country that has done this on an enterprise-wide basis. So we're looking at it across programs and across systems, whereas most states will look at it in one program and it's siloed. So we've sort of opened that up, and we're really, really focused on that. And then we have some smaller things we're doing to ensure that citizens are receiving the services they need. We put more money in the budget this past year. We're not just cutting. We put some more money in the budget for the waiting list for the intellectually disabled, to move people off of the waiting list. We have a commitment to do more in the next budget, and really looking at health and safety issues for children to ensure that children are safe in their environment.
And that's a tough one. Obviously, my predecessor, Representative Bev Mackrith, is now one of your deputy secretaries. She worked at Children and Youth. So that's a critical. She has a lot of experience coming up through the child welfare system. Obviously, we have child abuse as a forefront in discussions politically and across the country with obviously some horrific actions that took place here. What can we look for, maybe do a better job in maybe that realm in child abuse?
Well, one of the things we're doing, we just received a federal waiver from the federal government on for our child welfare system to have more flexibility. Once again, at the county level, we have a certain amount of counties that we've selected to decrease congregate care, ensure that children are with their families and that they are safe and sound. So we're looking at this very closely. Bev has put a lot of time into it. She was a great addition to our staff, and we're really happy that she's joined us. We're happy she left the ranks of being in the legislature and in the county, and she's now with us. But so she's really focused on ensuring, using that federal flexibility that we receive with the federal waiver to ensure that we reduce congregate care, keep children in their homes with their families when it's safe, and then move these children to independence. So it's more than just safety. It's reducing congregate care, but also ensuring that their future is bright. So we're starting to partner with education, labor and industry to ensure the children, as they move up the ladder, will receive the necessary job training through the educational system.
Yeah, it amazed me when she was at the county Human Services Department how much money we were spending to put kids into care, taking them away from their family and putting them into care versus just trying to find an aunt and uncle, somebody within their family, someone who loves them, someone who's going to take care of them. And it amazes me how just that change of, you know, bringing people to their family rather than a big government approach of taking somebody out and putting them into some kind of institutional care. Better for the kids, better for the psychology, and obviously a huge cost saver for back taxpayers.
No question. We have to work with families.
Yeah.
That's where it's at. Keeping families close and keeping children with individuals that love them and they love.
Yeah, that's awesome. One final note. We're obviously continuing the great fight. We're coming into kind of next year's budget coming up. How do you think your budget's going to shape up for next year? Are we going to have to do more to help you out, to provide more flexibility? What can we do?
We always would enjoy more flexibility at the department. But as I had said earlier, the department, when the governor took over, was growing at double digits, over 10% year over year. We've brought that growth down to about 7% year over year. That's no small feat what the governor's done. However, revenues are still only growing at 2%. The department's growing at 7-8% year over year. And I think between this year to next year, our growth will be over $500 or $1 million in just growth, natural growth through healthcare utilization and many other things. So we will need to partner with the legislature and work with the legislature to drive more pragmatic reforms into the system, whether it's on the long-term care side or ensuring we're putting more individuals into the workforce rather than having them stay on the system.
Yeah, that's great stuff. Unfortunately, we are out of time. I truly appreciate your time, and I definitely want to have you back maybe next year for an update.
I would enjoy coming back.
Yeah, terrific.
Thank you.
That's all the time we have for today's program. I'm State Representative Seth Grove. If you need assistance with any state government matter, please feel free to contact me in my local office or through my website. That information will be shown in a moment. Thanks for watching, and please join me next time for a legislative report.